Welcome to At Issue. My name is H. Wayne Wilson, and we're going to be talking about military service and what impact it has on the lives of those who have served. We, of course, have a growing suicide crisis amongst veterans and active duty military and other issues associated with combat trauma. And that is amongst 1.3 million active servicemen and women and 22 million veterans in America. And to have that discussion, I've invited to join us at the table Brad Singer. Brad is the clinic chief for behavioral health team at the 1st Heavy Brigade Combat Team, 3rd Infantry, Fort Stewart, Georgia. Thank you so much for being with us.
Thank you for having me.
And you're also a licensed clinical social worker.
Correct.
Okay. And let me also I asked Nicole Nicholson to join us. Nicole is the readjustment counselor at the Peoria Vet Center. And the Vet Center is, how's that related to the VA clinic?
Yeah, the Vet Center, we're strictly readjustment counseling. The VA clinic, they offer health care, primary care, mental health, and other specialties. But the Vet Center strictly offers readjustment counseling. And
also here for the discussion is Jerry Moreland. Jerry is a veteran who served in Vietnam. He is retired from the Central Illinois Light Company, but for our purposes of our conversation, he served in the 576th Ordnance Group in Long Binh, Vietnam. What years were those?
67 and 68.
Okay, thank you all for joining me on the program. First, I suppose a discussion about how prevalent the problem is. I did some homework and I can't come up with good numbers. It's all over the place. It's from 18 suicides per 100,000. It's 29 suicides per 100,000. The civilian rate is supposed to be somewhere around 18 or 19 per 100,000, but it depends on whether you're in the Guard, whether you're in the reserves, whether you're active. So rather than dwell on numbers, how would you and we're going to talk about more than suicide, but in terms of suicide, how severe is the problem?
Well, obviously the problem is quite severe. We've been watching the numbers rise in our active duty and veteran populations for years. And I think that instead of getting bogged down with numbers, we need to look at it from a standpoint of, looking at preventative measures, how to intervene, before these things happen. But it's definitely a problem that we are seeing in the active duty population that we serve right now. And
as far as veterans, it's an issue.
Oh, absolutely. We'll see it. We do suicide risk assessments at the Vet Center because I identify all clients that I see, everyone's at risk. So at each session, if they were to come in, we evaluate that and proceed forward for treatment.
There are certain signs that you look for that would indicate to you from your experience that someone might be prone or think about suicide?
Sure, because everyone's at risk, but some of common symptoms that might arise from veterans would be some depressive symptoms, maybe some suicidal thoughts of harming themselves, maybe just life events as far as struggling between depression and irritability, relationship struggles, financial, just life in general, readjustment issues.
And you deal with much more than just those who might be suicidal. You deal with a lot of mental health issues.
Correct.
What are some of the examples of things that you see for active duty?
In our clinic, we see basically any kind of mental health problem that you can imagine. Most of it is life. We see a lot of the PTSD from combat, but we see a lot of marital problems, we see a lot of anxiety, depressed moods, a lot of family problems from the deployment, whether they come back from a deployment and the spouse has chosen to leave, take the children and move back to whatever state they're from, leaving that active duty member there alone. So, it's just kind of anything that you would see in a community-based mental health treatment center, we kind of see at Fort Stewart, just with the Army contingent upon it.
So you have to have all sorts of ways to deal with this. I mean, if you have so many different symptoms, how do you offer solutions to all of those?
Well, we have to approach it from a very broad standpoint and then narrow it down from there because, again, every soldier that comes in is going to come in with a different issue. So all of our providers have to be well trained in how to address anxiety, depression, family problems, marital problems, problems with children, parental issues, PTSD, across the board. So we do, pretty thorough evaluations in the beginning, really get the soldier in and get them comfortable, because of the stigma of mental health care in the military is pretty substantial. So we have to get them in and get them comfortable in order to really kind of peel back the layers to figure out what the issue is.
And do you see similar symptoms because you deal with veterans?
We do, and a lot of the times the public may not be aware or distinguish between the VA medical centers and the vet center. So the vet center was established by Congress in 1979 for service members returning home from the Vietnam War, experiencing readjustment issues. So the services that we provide at the vet center provide employment, substance abuse assessment, and referrals, along with readjustment counseling, individual, family, and couples. But we also provide military sexual trauma and bereavement counseling. There's about over 200 vet centers nationally located, and there's about 11 vet centers located through the state of Illinois.
Brad mentioned the stigma of mental health, and I'd like you to share with the audience the first time you went to the vet center where Nicole works. You had a little bit of an issue when you saw a sign.
Yeah, when I started having problems with nightmares, and it escalated to the point of almost every night, and it was always the same nightmare. My wife is actually the reason that I went to the vet center. And of course, I had to go through the vet clinic to see a psychiatrist, and when I walked in and seen mental health above the door, it was earth-shaking to me. There was a sense of embarrassment, first of all, and to my knowledge, no one in my family has ever had a mental problem, and I took it very personal, and still do to this day.
Is that something that, do you hear these kinds of issues, and do you change the way you deal?
Yeah, we typically do hear this. I mean, it's the whole stigma that you go about as far as the public having a mental health treatment. And at the readjustment, at the vet center with the readjustment counseling, we offer that safe environment. A majority of our staff are veterans themselves. We have 3 currently still serving. We have a counselor. We're all licensed therapists. Having that connection and understanding with the veterans and their families, I think, make the veterans feel more comfortable and open up to have that safe environment.
So once you got past the sign, you were,
Right.
you
It's not a quick process. I was fortunate enough that my wife went to several months of counseling with me, because she was unaware of my problems and what I'd done in Vietnam. She knew I was there naturally, but she didn't know what all took place. And the counselors gain your confidence before you even have the willingness to start talking. And that was very important, especially to me, because I didn't particularly care to share my events in the first place. But it was getting to very serious as far as my being able to sleep at night, affecting my wife's sleep, the irritability the next day, withdrawing from society as groups and stuff. So it all plays a part. And once I felt comfortable with the counselors, then it was much easier to talk.
I want to talk more about your situation, but I want to turn to Brad for just a moment, because you talked about the issue of being comfortable, and is that the first step? Is it different for active duty than it is for a veteran who, and his symptoms showed up 40 years after the fact?
I'm sure there's a little bit of a difference. What that is, I honestly couldn't get into the specifics, but I think just because of the time frame, it had been 40 years, and it was probably quite a shock to Jerry that these symptoms were coming up. But as far as, with the active duty, it is about eliminating the negative stigma about being here. It's about talking about the normalcy of the fact that they're having these symptoms and where they're coming from.
Do they not want to talk, though? I mean, he didn't even tell his wife about the specifics of what happened in Vietnam.
I've seen significant variations. I've seen some guys come in and it's almost like they've been holding it in for so long they haven't warmed the chair up yet, and they're dumping a lot of emotional material into the room. And I have other soldiers who come in and it's not until session 8, 9, or 10 when they're ready to talk about what's really bothering them.
Is it different for women than men in terms of the communication, the initial being able to speak about what had happened?
Sure. The clients that we see at the vet center, typically the female veterans, they're more open in processing their emotions compared to men. But it's not to say that all men are like that either. But we do see more women being expressive and more in touch with their feelings. But for the veterans, for the male veterans, for themselves, we just give them that time to let them open up, let them feel comfortable. We provide free readjustment counseling to eligible veterans. So eligible veterans are veterans that have served in a combat or hostile area. For example, World War II veterans, Korean and Vietnam War veterans, and to the even recent conflict, Operation Iraqi Freedom, Operation Enduring Freedom, Operation New Dawn. But other conflicts that the public may not be familiar with also that we provide free counseling to would be the Panama, Kosovo, Somalia, the Persian Gulf. But if individuals don't fit, if they have never been deployed in a combat or hostile area, we also provide military sexual trauma counseling to service members that have been sexually harassed or sexually assaulted, and also bereavement counseling to families that had service members on duty.
So it covers a gamut of areas. Let me turn to Jerry again. And and for the record, I served in Southeast Asia. And when I came back, I didn't talk about it, except to family. I did talk to family. Now, you didn't even talk to your wife, other than in general, yeah, I served in Vietnam.
That's true.
Why did you not say anything? You internalized everything.
Yes, I did. First of all, I was drafted. I did not want to go. I was ashamed of my participation in what I had done. I took a life. That goes against everything that I was ever taught as a child. And I think a lot had to do with how others would perceive me if they knew this. So I just didn't talk about it.
And because you internalized it, how long did it go before you had the issues?
44 years. And I started having nightmares. And the nightmares started, they were rare, maybe every month and a half, and then they escalated. And when I went to vet services, it was almost every night, and sometimes 3 times a night.
Same dream?
Same dream.
And it was
like
you were in Vietnam?
I was in Vietnam. It was like a repeat over and over and over.
And just for clarification, this reflects back on the Tet Offensive in 1968?
Yes, January 31st of 68.
And actually you had extended your time in Vietnam, and that's why you were there at that time.
Yeah, that's another thing I struggle with. I should have been home, but I stayed an extra month to get out 89 days early, so I didn't have to serve in the United States.
And as a result?
As a result, I got to experience a Tet Offensive.
How difficult is it for someone like that who has internalized all these years to get them to open up? I mean, how do you go about this? He said he didn't have to talk right away.
Yeah, meeting with the veteran where they're at, compared to the veterans on active duty, they're constantly on duty. They have the day-to-day tasks, the mission at hand. And like Jerry's case, being retired and having more time, analyzing life events, past circumstances, just meeting where they're at, letting them feel comfortable, letting them know that they're normal feeling these symptoms, that they, most often some of the veterans feel ashamed or embarrassed, or they don't really know how to internalize the symptoms that they're feeling.
And that would be, in general, I know every case is individual, but in general that would be different for active duty, because Jerry, he was okay until he retired. You were active in the Morton Fire Department. You were the fire chief, I believe.
Yes.
You were active in work, active at home, etc. All of a sudden he's retired. He has time on his hand, and his mind goes. But active duty, might that be different? Because they're busy from 6 to Who knows?
They're
when.
very, yes, they're very busy. So a lot of times they have to push everything to the back and have this mentality that I'll deal with all this stuff later. And for some of them, that later arrives when, like at Fort Stewart, our deployment cycle has really slowed down. So for a lot of these soldiers that have been in since 2001, 2002, and have been deployed for a year, home for 8 months, deployed for a year, home for 9 months, deployed for, that up tempo does not give them that idle time to ponder or think about these issues. Whereas now that we're not deploying near as rapidly and the mission is dying down, they're kind of sitting around, idle time's catching up to them, and so a lot of these symptoms are kind of creeping up and rearing their ugly head, so to speak.
How difficult is it to tell a macho veteran, you need help, and we might have to give you inpatient help?
Mm-hmm.
I mean, these are men and women who, I can handle this. And what do you say to them?
All I would say, as far as the current active duty, it's a different generation. So the idea of asking for help isn't as much of an issue as even when I was growing up, or the Vietnam veteran era. But it is an issue in the sense of, having to take them off the line. If you have a hardened combat veteran, E7, E8, who's deployed 5 times in the last 10 years, to all of a sudden tell them, you need to come out of that supervisory role for a little while and take care of yourself. It takes a lot of genuine work with them to get them to engage and buy into this fact of, I finally can take the time to take care of me, not take care of all the soldiers and everybody else around me. It's time to take care of me for once.
For the audience's benefit, E7, E8, E stands for enlisted, and it goes from E1 to E9. So E7, E8 is someone who's been in for quite some time.
Correct, yes.
And I want to talk a little bit about, you can't have all the answers. How wide of a network do you have in order to help not just Jerry, but the different veterans who come in with a host of symptoms?
Yeah, we work with our community. Our biggest part of the Vet Center is our outreach efforts. So not only educating veterans and their families, but the public. And so we work a lot in collaboration with the VA medical centers, particularly the Bob Michael VA outpatient here in town. We work with the Veterans Service Officers, Veterans Assistance Commission, Salvation Army with the Veterans Outreach Center, Goodwill Common.
Do you have the same kind of network down there, or is it more of a Fort Stewart is kind of its own city?
It's more of a close-knit system. The active duty personnel, we have to go through a lot of steps to get them referred to anything outside of a military provider. We do have the ability to refer to some of the local VA clinics or hospitals for specialty care, such as a TBI clinic down in Tampa Bay, Florida, or the PTSD treatment center either at Fort Jackson, which is in South Carolina, or the Charleston, South Carolina VA has a nice PTSD treatment center. Outside of that, we can refer to some TRICARE providers in the community or even in the southern region, but most of our soldiers are treated and handled on Fort Stewart.
And you mentioned TBI, that's traumatic brain injury.
Correct.
Is there a difference between someone who's, these are people who were in combat, but some have been in a Humvee that has hit an IED, et cetera, and have had physical damage to their mind. How do you handle those?
The biggest thing that we can do from a behavioral health standpoint when it comes to traumatic brain injury is making sure that they've had the proper evaluations by the appropriate people. When those events occur downrange, they're usually either out on a mission, out on a convoy, so they get a real quick screen from a medic. You good? Okay, keep going on, push on through the mission. When they return home, a lot of them still have the dizziness, the ringing in their ears, the migraine headaches, the light sensitivity, the irritability, problems sleeping, all symptoms of a traumatic brain injury, and they just keep pushing on. So we have to kind of help them realize that, hey, you experienced 3 IED blasts within a 6-month time frame. you probably need to go and see the neurologist on post, get a thorough TBI evaluation done. Let's just make sure that there's not something bigger here going on that you're just unaware of or unwilling to admit is going on.
And we probably should mention IED, improvised explosive device.
Correct.
Do you see much of the TBI issue, or are you dealing with veterans who have gotten past that stage and have other issues?
We see a variety of readjustment issues. So we do assess for traumatic brain injury and post-traumatic stress disorder, and we would work in collaboration in terms of them needing more medical care, and in conjunction, excuse me, receive readjustment counseling at the vet center. Anything from struggling with mood management, whether it be irritability, depressive symptoms, anger. So a variety of readjustment issues is what we see with our clients that walk through at the vet center.
So let's talk about your progress, Jerry. You came in, you saw the sign, you didn't open up at first, you were there because your wife said you're going. Is that true, right?
Pretty much.
And so how are we doing right now?
Well, I'm seeing improvement. It's slow. It's slow. And I'm told that the nightmares may never go away 100%. But I can at least deal with them now. I don't always wake up where I normally did before. They don't bother me the next day in thought like they were for a while. I think one of the big hurdles for me was I didn't want to go to group with other Vietnam veterans to talk about our problems. Once I started doing that, I realized that I wasn't out there by myself. That we've all got problems. They're similar, but they're not alike. And when I seen that, I started seeing things a little bit different. That yeah, this can be controlled in my mind, and that's where it is. It's in my mind. But I do see improvements.
And group is?
Yeah, we do a lot of groups. We offer a variety between Vietnam era. We have a GWOT group, which is the Global War on Terrorism. That would include our Operation Iraqi Freedom, Operation New Dawn.
So what's the benefit of group versus one-on-one? I mean, he was hesitant. He said, I don't want to share this, but
Right.
but there is a benefit.
Absolutely. You know, it gives them a chance where if they didn't feel comfortable enough to speak up, or they're just there to listen, to get that comfortability, so to speak, at first, just for the few sessions. And they may not feel at first. It may take them a long time, and they may never. But at least we encourage the veterans to come out and seek out our groups that we offer. We do everything from PTSD groups. We have a women's group, so a lot of
And
times.
we'll talk about that in just a moment. But group sessions?
Yes, we use groups as well, and what we see is one of the biggest things that I have seen doing these kind of groups for PTSD is the sense of normalcy. You know, the fact that Jerry probably was able to, for the first time, and maybe for a little while, or you know, the active duty, for the first time in a long time, they feel like this isn't just me. I'm not crazy. There's not something wrong with me, because everybody else in here is struggling with the same thing in different variations. So that sense of normalcy, that sense of I'm not alone, and that sense of, you know, relief from the simple fact that I'm not losing my mind really tends to stabilize a lot of these soldiers that I see.
And they tend to listen first and then?
Correct.
Engage.
Because
Sure.
By all means.
Yes.
you didn't
No.
spill the beans right away.
No. And I haven't spilled all of the beans yet. But in time, you know, it's the time has to be right and the mood has to be right.
If you don't mind me asking, you described the incident that, I assume the one incident that really bothers you is you took a life. And
Right.
that goes against everything. But you used the term took a life. Is that intentional?
Yeah, that's intentional. And it's not necessarily taking a life, it's the way it was done. The weapon that I was given to use, which was a shotgun. And shotgun is normally a little closer in response. And it all has to do with seeing the individual afterwards. How that affects you is the age of the individual was extremely young.
And You are making progress, though, in your
Oh,
own estimation.
without a doubt.
And you would agree with that?
Oh, absolutely. I mean, the support that group members get from one another, that connection and that bond that they get is just priceless.
The women's group meets when?
The second and fourth Mondays of every month from 6 to 7:30.
And they can call 689-9708.
Correct.
And the Peoria Vet Center is located at 8305 North Allen Road. Let me say thank you to Brad Singer of Fort Stewart, Georgia, and thank you so much to Jerry Moreland.
Thank you.
For sharing your experience, and thank you to Nicole Nicholson of the Peoria Vet Center. We thank you all for sharing in this conversation. Next week, we'll be back with another edition of At Issue when we're going to be talking about opportunities for young African Americans. We know the unemployment rate in the southern area of Peoria is very high. We're going to look at some solutions next time on At Issue.